Hi, my name is Brian Wormers. I'm one of the nursing faculty at the University of Sioux Falls, and today I'm going to be reviewing this course syllabus for NUR 431 Nursing Capstone. So you can see on the top it's for USF, School of Nursing, and so the dates this year are going to be January 2nd through May 2nd of 2025. This is a 3-credit class. And so you can see more details about it in the course catalog if you want for prerequisites. This is going to be a diverse modality course with some clinical hours. Instructors will be myself, Megan Fredrickson, or Jessica Jarding. Course description: the focus of this course is to provide clinical opportunities for you to grow in your professional nursing skills and knowledge, as well as to prepare you to take the NCLEX. So we talked about that diverse modality course. So realize that you're going to start off by doing clinical hours with your preceptor, and then you're going to be having online hybridized courses, including lots of work with ATI to prepare you for NCLEX. Learning objectives: we want you to be clinically competent, looking at nursing knowledge from prior coursework. We're going to reflect on what is it to be a professional nurse. We're going to apply that nursing process to a patient or a population, and then we're going to look at the student outcomes, and you're going to actually write on some of these student outcomes and do a paper on them. These will include the following, and you can review these here, but realize that these are going to be important on some of your upcoming assignments. And then 5, review major nursing content areas in preparation for NCLEX. So, School of Nursing, mission, goals, and expected outcomes. If you were curious about what we are doing, why we are doing it, this is it. And tied to that is our theoretical basis. So you can look at this and look at the competency tracker to see why you're doing what you're doing. Required resources: it's going to be varied. We do expect that you can access some of these things. There's a link here for the Code of Ethics. Realize that you can access this via Wagner Library for the scope and standards of practice. And then we expect you to have an APA book or access to it. And then all previous nursing references might be useful for you during this course. Evaluation: there's going to be a lot of pass-fail on this one. We do have to have you up to date on Castle Branch, which I believe all of you are, but make sure you maintain that and continue that. You will have to communicate all the time in this course. You're going to hear it time and time again, but you have to have good communication. You have to be, sending us emails, uploading stuff on LMS. If you have any concerns or questions, you have to reach out to us and talk to us. But make sure that you are, keeping your clinical calendar up to date in a place that we can see it, and letting us know about it. So communication, communication, and lots of communication throughout this whole course. You do need to complete all your clinical hours and have satisfactory evals by your preceptor. Reflections: you'll be doing clinical reflections and doing quite a few of those, and we'll get into the details of what that means in a little bit. We'll also have you do an evaluation of the capstone. What did you like? What didn't you like? And how can we improve this? We're going to do lots of different assignments. We'll have a synthesis paper on the role of professional nurse. What does it mean to be a nurse in the area that you're going to have your preceptorship in? And realize that, a NICU nurse might be different than a peds nurse, different than an adult ICU nurse, different than a GI nurse, different than ER or flight, or, we've got so many different roles within nursing. And what does that look like? Yes, there's going to be some basic overlap. There's going to be, ANA, and we want you to write to that. What does it look like to be a professional nurse? In addition to this, you're going to have a capstone reflection. So this is a summary paper talking about how you hit all the core requirements of what we feel like it's very important to be a nurse. And so you'll write up on that, and then you'll do a poster presentation. You'll record it so we can grade it, and then you're also going to be presenting it. Then you'll be doing lots of NCLEX prep work, including ATI and an ATI capstone component for this course. So that will mean that you get weekly ATI Capstone content, and we'll go over that in a little bit, and actually in a different video. You'll have weekly ATI dynamic quizzes that you get to do. We started this last year, and the students found this very, very beneficial for when they took NCLEX. So you will probably have a very strong love-hate relationship with ATI at the end of this course, but if it helps you pass NCLEX, it's worth it. Now, you also get to do lots of different practice exams. So you'll have practice A with remediation, practice B with remediation, comprehensive predictor, which is going to be to simulate like an NCLEX, and then of course remediation on that predictor. You'll have an NCLEX live review session where ATI will come out and they're going to have a couple of day intensive review session with you. And all these are going to be very important because we will look at all your ATIs prior to this and how you're doing on these ATIs to see what areas you need to study and best prepare you for NCLEX. My advice is to take these very seriously. Treat these as, mini NCLEX exams so we can see how you're doing on them. We can see your strengths, we can see your weaknesses, so we can really focus you in on what you need to study after graduation, so you can take NCLEX once and be done with it for the rest of your career. So that's what this is going to be about. So we will look at all your ATI information, all your courses, all your classes, and we will come up and we will have a plan for you about when you should take NCLEX, what you should study, how you're going to study, what are some of the study tools and the things that you need to focus in on, and we're going to individualize that for each one of you. Nobody should have the same plan. All of you have got different strengths and weaknesses, and we really need to discuss those with you. Now, if you take your ATI comp predictor and you score less than 80% or have a less than 80% chance of passing, you are required to take virtual ATI, and then once you are completed with that, then you'll be completed with this course as well. This is not getting 80% of the questions right. This is 80% chance of passing based on that. Once again, I want you to take this very seriously. Now, with the virtual ATI, realize that that would go on after graduation. You would go through and you'd graduate with your class, and honestly, nobody would probably even know if you had to take this. But to pass the class and to, graduate officially from USF, you need to take this. So take the comp predictor very seriously, do your best on it, and then you don't have to worry about this. So grades are going to be the same as they always have been throughout the course. So 90, 80, 70, 60, you need a B- to advance within this course. Late assignment policy, we're not really doing this. It's going to be a case-by-case situation for extenuating circumstances, because so much of this class builds, you really can't push things off. And a lot of this is like presentations, and we don't have like an alternative presentation date. So it's really important that you look at those due dates and make sure that you're attending and doing these things that you need to. So evaluation, some of the things that we're looking at, communicating of the clinical calendar in a timely manner. It's basically a Google Doc. You'll put your name on it. You're going to put the time that you're in clinicals. All of your faculty are going to be on call while you are doing your clinicals. So we need to know when we have to be available in case something was to happen. If you get a needle stick, if there's an accident, if there's any situations that you're involved with that we need to respond to. So this needs to be done within 48 hours or prior to 48 hours of your scheduled shift. And it will help us keep up to speed on this and make sure that we're available in case anything was to happen and you needed us. Weekly communication, this is going to be on the LMS. This could be as simple as one sentence, or this is going to be, what did you like, what didn't you like, how are things going, everything's great. Oh wait, had an issue with my preceptor. They said something kind of interesting, I'm not sure if I agree with it. It can be any of that stuff, but we want communication with you on a weekly basis through the LMS, and it's just a quick comment. Completion of all clinical hours within this. You're going to have your clinicals here. You need to have 90 clinical hours at least. You will not stop during a clinical hour. So if you hit your 90 hours, but you've still got 5 hours left of that clinical shift, then you get that 5 extra hours, which is awesome. That being said, we just don't want you to be like, oh, 90 hours, I'm out of here, see ya, thank you. Finish that shift, be a good steward, and appreciate the time that preceptor spent with you. They will have an evaluation form. This is going to be on the packet that you've received already, as well as you can access on the LMS. You need to have a competency score of 0.8 as a final grade, and they will grade you on this. Clinical reflections. So you need to record all of these. You're going to have one after each clinical shift. You're going to have we want you to do on each shift you have. And it's going to be a reflection very specific to something we tell you to reflect on or give you choices to reflect on. But it's to help you grow, help you think about what you're doing, and get you ready for graduation. Student evaluation, this is when you give us some feedback on this and feedback on your preceptor, so that's great. Synthesis paper, so you're going to be writing about the entire nursing experience that you've had and how you've experienced that within Capstone. Capstone reflection, so this will be a review of your Capstone experience as a whole. You will reflect on the student outcomes for how you've done throughout the whole. Clinical experience poster presentation. You will have a poster presentation in which you are reflecting on a case study. This will be a snapshot of your patient, and it's pretty well laid out about all the different things that you have to fill out. You will record this so we can, as your faculty, can grade you on this, but then you'll also present this on the School of Nursing's campus. Weekly ATI Capstone content. See that there will be a Capstone calendar out there. We've got a recording of it, and you can do that. But realize that this is going to be a repetitive type of thing. It's going to cover contents like fundamentals, and then med-surg, then peds, then maternal, then high acuity, well, probably more along the lines of med-surg, then leadership. So it's going to have all these different areas that it breaks down into, and every week's going to be a new chapter, so to speak. HI dynamic quizzing. So you're going to develop dynamic quizzes that you have to do. For the first 6 weeks, it's going to be 100 questions for each quiz, and then you're going to switch into just 25 because you're going to be busy with other coursework. So we'll give you breaks. We're not going to make you do this over some of the breaks and such like that. But it needs to be over comprehensive content, and you need to score at least 60% to earn points for that dynamic quizzes. This is how you do it. It doesn't have to be timed, and it's just going to be great to get you exposure to NCLEX style test questions. There is remediation, so for your ATI testing, this is the remediation that you'll do. So this is kind of like the dynamic quizzing that we just talked about above, and this is what you'll need to do. So if you score a 2 or 3, you've got less questions that you have to do. If you score a 1, you got 30. If you score below level 1, you got 45. So that would be your remediation for your ATI testing. You do have to attend the NCLEX live review session. On one of the videos that you will watch, we'll tell you a little bit more about that. But this is going to be live, and you'll be in person, and an ATI expert will come and work with you for a couple of days on this. And it's going to be beneficial for you for your taking your NCLEX. Let's see here. So we talked about the virtual ATI before. So once you take your comp predictor, if you score greater than 80% chance of passing, it's not getting 80% right, so take a break. Everybody passed it last year. But if you get less than 80%, then maybe you're not ready to take NCLEX. So we want to support you. This isn't meant to be punitive. This is meant to help you, bolster you, and get you ready for that NCLEX so you can take it once, be successful, and not have to take it again. Course schedule, so your clinical experiences, we talked about that. January 2nd through January 31st, so the month of January is dedicated to this. clinical reflections during this time. First upload for 1 through 4 is going to be due on 1/19. Final upload is due 2/2. ATI dynamic quizzes every week. You're seeing that 100 questions and then 25 questions, just to keep you practicing and staying on top of those questions. This is when you're going to do the comprehensive predictor and practice exams. So practice A, practice B, and then your synthesis paper is due on 1/26, your poster presentation. I need you to submit this as a PDF file on 1/31 by 8 o'clock. I will take this in, print you off a poster from Staples probably, and then get that poster back to you. I need you to record a presentation and upload it to LMS by, before you actually have your presentation. So we as your clinical faculty can review it and grade you on that. And then your live presentation is going to be on February 6th from 12 until 1, and it's going to be in the Jeske Center. Capstone Reflection Summary Paper is due on 2/16. You're going to have HAI course, and it's going to go throughout the most of this course. It begins on 1/27, and it's going to be like a weekly type of thing in which you've got assignments that are due. Tied to this, we talked about the comprehensive assessment. So proctored A, proctored B. We're going to kind of see if you make progress with this after you've taken this course. And then your live review is April 28th through April 30th. This is what we cleared with ATI. This is what I believe to be correct, but if they change it on us, then we have to adjust. Policy and procedures, you've seen these on all of our syllabi, but academic honesty, don't cheat. If you have any questions about that, please review this. Compliance with ADA, if this applies to you, please let us know, or the Academic Success Center know, and we're happy to work with you on this. Program assessment, you will have IDAs for the courses that you take during your time here at USF, and we want to know feedback on this. Copyright, please don't break copyright law. Cite and reference your things in APA, and if you have any questions about that, please talk to your instructors. That concludes just a quick overview about the syllabus and some of the things that you're going to see in the course. If you go into other aspects of this soft chalk module, you will see more details about some of the assignments and some of the things that you get to do. So I'm so excited to see you in this course, and I think you're going to grow and develop, and I hope you have a wonderful time. If you have any questions, reach out to us, and we're happy to help.